Hi, I'm Stephanie. I am one of the co-founders of PurpleRock Construction Services, and I'm excited to jump on here this morning because it is November 1st, which means that it is officially the beginning of Epilepsy Awareness Month. Some of you know our story, at least at a high level, and know that epilepsy awareness is a cause that we are incredibly passionate about, both as a family and as a business. In fact, the purple in PurpleRock and the logo itself are both inspired by the Epilepsy Awareness ribbon. So in honor of Epilepsy Awareness Month, we wanted to take some time this morning to share a little bit more about our story with you, get a little bit vulnerable, and let you in on how epilepsy's impacted our lives, our family, and also share some ways that you can support the community, support those who are also facing this disease. There's a lot of unknowns when it comes to epilepsy as we're learning, and so resources towards research and education and just finding a cure for this disease are so important. And so I'll share a little bit more about that as well. But I'll get started by sharing a little bit more about our story and how epilepsy has impacted us. So some of you know we have a 3-year-old epilepsy warrior. His name is Everett. He was diagnosed with epilepsy right after his first birthday, but his seizures started a little bit before that. So it was Christmas Eve in 2018. Everett at the time was 10 months old when he had his first seizure. I remember being just completely in shock. I had never seen a seizure before that time. I don't think that anyone in our family had. And so, of course, seeing our 10-month-old having a tonic-clonic, some people call them a grand mal seizure. They're the ones that many people would envision when you think about epilepsy, was certainly shocking. And so he was taken to the ER. We were in the hospital on Christmas Eve. At the time, it was his first episode. So they diagnosed him with febrile seizures and sent us home. Febrile seizures are something that many families, many children are impacted by, but that they can grow out of and doesn't necessarily indicate something more serious going on with their brain or anything like that. And so we went home, we celebrated Christmas the next day. Over the next couple of months, his seizures started to change. So we had a couple of more ER visits in January and in February. And then in March, right after his first birthday, Everett started having recurring seizures that we just could not get to stop. They were back to back for about 2 days. Obviously, we went to the ER before those 2 days were up, but we spent about a week in the hospital right after his first birthday, and that's when he was first diagnosed with epilepsy. He was put on medication, which he responded really well to, but it didn't completely stop his seizures. We were lucky in the way that he responded, in that for the most part, he had a significant decrease in his seizure activity once medication was started, but it didn't stop them 100%. So we continued to monitor him. We started seeing a neurologist. The life of an epilepsy patient has a lot of specialists involved. Like I said, there's a lot that is just still unknown. We did some preliminary genetic testing, just a lot of follow-up appointments to try and learn more about what was happening with our sweet boy and on how we could help him. I'm gonna skip forward a little bit. About a year goes by. Things seemed pretty stable with his seizure activity. In fact, we went about a full year without any noticeable major seizures, which was amazing. But then we recognized that his seizure medication was causing some issues with his kidneys. It was causing his kidneys to swell. It was giving him kidney stones. It was just causing a lot of pain for him. And so in 2019 and into 2020, we had to wean him off of that medication and put him onto a new one. This medication he's doing pretty well on as well, but it just lots to learn there. The weaning process was hard and scary, and he certainly had some breakthrough seizures during that time. In March of this year, we started to see a lot more seizure activity with Everett. and different seizure activity. So most children, as I understand it, and mind you, I'm not a neurologist, so don't take any of this as medical truth, but just as I understand it as an epilepsy mom, most children who have a form of epilepsy will have one primary seizure type. Everett experiences all of them. I didn't even know before our diagnosis that there are multiple seizure types, but there are several. Everett experiences all of them and has experienced all of them in the past, which makes his epilepsy a little bit more complicated to treat and to figure out. So in March, those seizures started ramping up again. We started a second medication at night to help him sleep because he was having a lot of nocturnal episodes, which as a mom are very scary because, you know, he is in his own room. We have a monitor, but it's scary. And so he started having a lot of nocturnal episodes. We have been tracking them very carefully and very closely. But he did end up in the hospital again in June of this year with another bout of recurrent seizures that we just couldn't get a grip on and couldn't get a handle of or stop. So we were back in the hospital for about 3 or 4 days in June. At that time, we decided that we needed to get a second opinion, and we called an epileptologist in the area, which again, before being diagnosed, I didn't even know that there was such thing as an epileptologist. I just believed that seeing a neurologist was sufficient. And his neurologist is amazing, but as we've learned, there is just a different level of specification to become an epileptologist. And when there are complicated cases like our son's, it's always the best route to find a specialist who deals specifically in pediatric epilepsy because they just know exactly what they're looking for and what to look for. So we scheduled that appointment. As you can imagine, specialists of that caliber certainly have a waiting list. I think any medical parent will tell you that once you land on a very good, high quality specialist, they are in high demand. So we finally got in to see this epileptologist just about a month ago, which was eye-opening. We learned so much in that just 1 hour appointment with him, looking over Everett's old charts, his EEGs, his video recordings and monitorings, and learned that a lot of what we've understood about Everett's diagnosis, about Everett's epilepsy over the last 2 years is probably wrong, that we have probably been treating something that we don't fully understand, that his neurologist didn't fully understand, and that requires some more monitoring, some more testing to really get to the root cause. So as of right now, November 1st, we are 2 weeks out from Everett's next hospital stay. He will be going back in 2 weeks to get some additional testing done, an MRI, some EEGs. We will be weaning him off of his medication during that time to get a baseline for how his brain activity looks, which is terrifying, as you can imagine. But it is something that is necessary so that we can continue to future plan and make sure that we're doing the best thing for our son. And for his continued growth and development, you know, obviously this is a brain disorder. It impacts a lot of his day-to-day. He is doing incredible. We are blessed and lucky that he continues to develop, albeit slowly. He certainly has some delays. He's behind his peers in a number of ways, but he is the sweetest and just continues to make forward progress, which is huge in this world. And so we're excited. You know, at 3.5, he knows his letters and his numbers, and you know, that's awesome. And so we're excited for that and for his progress. But the more that we can learn about his epilepsy and the more that we can really target what's going on, the better we can help him succeed and have a future. You know, one of the things, the story, I realize is a little bit long and it sounds like a lot, and it is a lot. I mean, as a medical mama, these constant appointments, these constant specialists, it is exhausting. If we're being fully transparent and vulnerable, it is quite a lot, but we are very blessed in that we have good health insurance. We work, we can take our son to the doctor. He can see the specialists he needs to. There are a lot of families out there that don't have that type of health insurance to help cover those type of appointments, the genetic testing, the just constant digging and research. It takes a lot, both emotionally, time-wise, but also financially. And we've been very blessed in that we've been able to cover that through our insurance and to cover a lot of that, a lot of the brunt of that through that. A lot of families aren't that lucky, and there are a number of resources in the community that can help support those families, and so that is something that we are very passionate about. And so, in honor of Epilepsy Awareness Month, I did want to share some ways that we are looking to support the epilepsy community here in Central Florida, but also ways that you can help get involved and join our team in November. So, here in Central Florida, there is an organization called the Epilepsy Association. I've spoken with them a couple of times. They're incredible and they're doing incredible work in this community, both in supporting uninsured or underinsured families in getting the epilepsy treatments and medical care that they need, and also in advocating for epilepsy research, education, and the building out of epilepsy programs. What I've come to learn is that work that this association was doing decades ago in Central Florida has truly impacted the way that our son has been able to receive care over the last 3 years. And so they are an association that I am excited to partner with and excited to support, and I hope that you will join me as well. On November 20th of this year, so in just 19 short days, they're hosting the Great American Epilepsy Walk, which is a virtual walk. You can walk from anywhere. You don't have to be in Central Florida. I know I've got friends and family and team members that live across the country, and you can participate from everywhere. What I'm asking is that you would prayerfully consider joining our walk team. It's under PurpleRock Construction Services. I will share the link here and in our bio so that you can find it. But if you would consider donating to our team and participating in that walk with us on the 20th, it would mean so much to us, but even more to the families that this money will go to support. Epilepsy is it's a hard walk, it's a hard journey, and it's a hard diagnosis, and it impacts everybody a little bit differently. And like I said, there's so much that's unknown. And so your support would mean the world to us. If you join our team, you can donate in any amount, and you can share, and I would love that as well if you would share this video and share our link and invite others to participate in the walk with you and with us. We will certainly be here on November 20th, and I will live stream that walk as well. But like I said, if you'll join that link, that would mean the world to us. We are just so grateful that we have a platform and an opportunity to give back and to support this community, and support other epilepsy patients, other epilepsy families that are going through a similar journey that we are, and may just need that extra support. And in the same way, those resources help to fund research and education that helps us. Because like I said, we knew so little. We're just scratching the surface of what we know when it comes to epilepsy, and specifically to Everett's epilepsy. And so these resources help fund those programs that help us learn more. So again, thank you for taking the time to listen to this story. I know it wasn't a short one, but I hope that sharing our story, being vulnerable, just sheds a little bit more light on epilepsy, how it can impact families and children in our community, and also just how you can help support. So if you have any questions, you can reach out to me directly. Feel free to shoot me a private message. I would be happy to answer any questions that you have about our journey with epilepsy, about anything. Just feel free to reach out. But thank you. I hope you have an awesome day and an awesome November, and we'll be back soon to participate in that walk. So we'll see you soon. Thanks so much. Bye.